And certainly I have a lot of fond memories about Dr. Luparello, and I'll just share a few with you. You know, we all remember him in a different kind of way, perhaps as a brother or an uncle, distinguished alumnus, and certainly for me and some others here in this room as a mentor. It was easy when we came together, we were doing some brainstorming as to what we should do with fundraising. And it was actually Ross DeMarco who suggested that we do something to honor Frank Luparello. At first it was a professorships chair in the Department of Biology in the Boyer School, and that morphed into doing something in this beautiful lecture hall in which we are this evening. And I think it's a great accomplishment, and it's truly an honor for Dr. Luparello how people came together so quickly and gave so generously. So I have a lot of fond memories of Dr. Luparello. He clearly, in my mind, was a legend. He was from Jeanette, where my family lived. He was an alumnus of St. Vincent. He was the director of the training program at Mercy. So I knew of him, but I really didn't know him. I didn't meet him until my second year in medical school at the University of Pittsburgh School of Medicine. And he was teaching a physical diagnosis class. And it was readily apparent that this was an outstanding clinician, an excellent teacher, just a great person. So it was an easy decision for me to decide that I would go to Mercy to do my internship in residency. So that was the easy part. The hard part came when I actually got there. So I started my internship July 1st, 1973. And in that given year, that happened to be a Sunday. So the program really started on Monday. But in the hierarchy of the hospital, you know, the senior residents graduate and move on, and the residents move up a year, and the low-life intern becomes the first-year resident. So there's this void for that given day, that Sunday, who was to take a call in the house. So prior to July 1st, earlier in the month, Dr. Luparello called a special meeting of all the incoming interns, and we had a little lottery to see who had to go to work that day. And it's the only time that I probably won anything in my life. I won the lottery, but I was really a loser because I was the guy that had to go to work Sunday morning. So Sunday morning, July 1st, 7 a.m., I'm at the hospital, white jacket, stethoscope, intern, wet behind the ears, and essentially clueless. Fortunately, I had a lot of residents and fellows and faculty to call upon, but as an intern and as the first responder, you have to do everything and anything from ordering laxatives to attending a cardiac arrest. So the day was long, little time to eat. The night was longer with no sleep. And the next morning, everybody was bright-eyed and bushy-tailed, and they came to the orientation thinking like, great, I'm a doctor. And I was withered and haggard, and I thought, like, what am I doing here? So with slitty eyes, I went to the orientation, went to the assigned unit, which I was to work in for the next several weeks. And then I went home about 7 o'clock that night. So after 36 hours of my first day of work, I said to my wife, I really don't think I like this. I'm not sure I want to do this. So with her kind words of wisdom, she pushed me out the door the next morning and into the arms of Frank Luparello, who after that really pushed me along, if not whipped me along. But he truly was my mentor. And being with Dr. Luparello was just an absolute treat. Making rounds were just great. Sometimes they were horrifying because if you were ill-prepared, it would be a death of 1,000 razor cuts. But, you know, if anybody knows me, they know that I'm a very warm weather person. I love the summer. But when I was a resident, I loved cold winter days, and I liked to see it snow. Because when I saw those big snowflakes come down, I knew that Dr. Luparello did not like to drive. He was always a no-show. So we could make rounds without him. But the path of least resistance was not always the best path because it wasn't the best educational process with anyone other than who we affectionately referred to Dr. Luparello as just the Loop. But rounds were good. It was an educational process. He knew how to extract the history from the patient. He knew the nuances of the disease. We would discuss the pathophysiology. And if you were the resident in disfavor that week, you knew that you would be crucified. If you did a good job, you got a little bit of praise, but you knew that you had a gratifying educational experience. The weeks were long, the work was difficult, and at the end of the work week, most of my friends who were not in medicine were winding down and they were looking forward to happy hour. But in Mercy Hospital on Friday afternoons, and some of the others can attest to this, we would get ready to go to what was called Death Conference. And Death Conference was in this tiny room in the bowels of the hospital where about 30 or 40 residents would have to meet, and we would discuss 2 cases from the previous week. And these 2 cases would be unfortunate patients that had passed away. They would usually be complex cases, patients with multiplicity and chronicity of disease. And Dr. Luparello would go through all the aspects of care and ask pointed questions and direct people. And again, if you were in disfavor that given week, you knew that you were going to be in for a hard time. At the same time, we would have a pathologist present, and the pathologist would demonstrate what was found at the time of autopsy and have the organs there so that we can look at anatomic specimens of the disease process and also the microscopic descriptions and review the pathology. So it was just a tremendous learning experience, but it was very difficult and grueling on the Friday afternoons. When I left Mercy and I went into practice, I had the fortunate opportunity to care for some of Dr. Luparello's family members and his good friends from the Greensburg area. And when they became ill or critically ill or had difficult problems, I knew that on any given morning I was going to get the telephone call. And I would think like, damn, I'm like an intern again. I would start to perspire and worry, and I would get the pointed questions. But it was all because it was superlative care. He wanted nothing but best care. And in medicine, it's not called good practice or better practice, it's called best practice. And that's what Dr. Luparello was all about. It was just the superlative. He wanted nothing other than that. So, I have a lot of fond memories, but, sometimes memories fade. The legacy of Dr. Luparello will live on forever in this room. And so for the students, I have to tell you that the teaching that I had from Dr. Luparello, not only in the science, but in the art and science of medicine, part of that came from what he experienced here at St. Vincent College. I think that your exposure here at St. Vincent allows you to appreciate and to tend to life a little bit better than others. I don't think that the art of medicine is an innate quality. Yes, we all have a gene pool, and some are brighter than others, and some of you have maybe a little bit more simpatico than others. But I think that here in your formative years of education, your exposure, your experience, your immersion, the theological and philosophical ideas that float around this place allow you to deal with issues, moral and ethical issues, better than students coming from any other place. And even in the sciences, the critical thought process that you are taught, allows you to solve problems and discuss issues better than others. In today's world, everything is evidence-based. It's no longer anecdotal success or normalization of deviance. It's all fact, and it has to be accurate, and it has to be evidence-based. So I think that the education that you receive here at St. Vincent is in the Luparello fashion and in the legacy. So, and I say this with great reverence with the new beatitude, blessed are the students, for they shall inherit the Luparello Lecture Hall and the legacy. Because that legacy will continue on. My memory will fade, but his presence will be here, and he will be able to touch many others, just as he's touched so many as Brother Norman had spoken of.